Nurse Nightingale. That was the name Dr. Caldwell had coined, and it stuck in the cardiac unit like spoiled blood on tile. He'd meant it to sting, the mockery wrapped in a saint's wings, the implication that she played savior when she was nothing more than competent staff doing prescribed work. Brooke Sullivan didn't flinch when she heard it. She didn't even slow her pace as she moved through the fluorescent-lit corridors of Seattle General's cardiac wing, her badge swinging against her ribs, her hand steady as a surgical laser. But what Dr. Caldwell didn't know, what nobody at this hospital knew, was that 8 months of night shifts under his dismissal had only sharpened her. The smallest details never escaped her. Not a single drop decimal in a medication count. Not a single variance in post-op narcotic distribution. And she was building a picture that would eventually demand answers he didn't want to give. The night of November 12th arrived like most other nights at Seattle General in Philadelphia. The city rain hammered the emergency department windows with the rhythm of distant helicopter rotors, and Brooke had just clocked in at 1:58 a.m., 3 minutes before her shift formally began. She moved through the darkened corridors with the kind of calm that comes from having already survived the worst. Her scrubs were navy blue, standard issue, crisp from the laundry. Her left leg bore slightly more weight on the right as she pushed a crash cart toward the cardiac unit, a shift so small that only someone looking would notice. Only someone trained would understand what it meant. Inside her left thigh, a titanium rod ran the length of her femur, a permanent reminder of a blast in Helm and Province that had shattered bone into fragments scattered like shrapnel through hospital sand. That had been 18 months ago. The healing was a separate kind of warfare, one fought alone in an apartment with the doors locked and the curtains drawn, one won through PT sessions that left her gasping, through a deliberate decision to rebuild herself into something nobody could break again. She'd changed her name twice before landing at Seattle General. Once legally, once practically. The first time was official paperwork and a fresh start. The second time was simpler. She walked into the hospital and became Brooke Sullivan, RN, night shift cardiac unit, quiet competence, no questions asked. Her service record was sealed. Her commendation file was archived in a Pentagon database that required 3-level authentication to access. Her discharge papers said medical discharge, chronic pain management, no return to active duty. All of it was technically true. None of it was the whole truth. The whole truth was classified, and it would stay classified until someone with a clearance higher than most admirals decided otherwise. The shift began with rounds. Bed 4, post-op open heart, vital stable, drip rates holding. Bed 7, pacemaker insertion, 2 days out, sleeping soundly. Bed 11, waiting for transfer to step down, an elderly man who kept asking for his granddaughter who worked at Walter Reed. Brooke recorded numbers in her electronic chart with the precision of someone who documented critical procedures in field conditions where a decimal point could mean the difference between a soldier walking or a soldier in a flag-folded box. She checked the 4 bags, verified the saline concentrations, confirmed the heparin doses with the computerized system that had been updated just 6 weeks prior. The cardiac unit hummed with the sound of life support machinery, ventilators wheezed their mechanical rhythm, cardiac monitors beeped in synchronized intervals, the 24-hour pulse of a place where hearts were either held together or were allowed to fail. By 3:15 a.m., she was in the supply room. This was routine, something she'd done twice a week since arriving at this hospital. The supply room smelled of plastic packaging and cold metal, the fluorescent lights casting everything in a pale wash of institutional white. Shelves lined 3 walls, organized by protocol, antibiotics, cardiac medications, emergency medications, controlled substances locked behind glass with dual access requirements. Brooke was cataloging the standard pharmaceutical inventory when she noticed the discrepancy again. It was small. Too small to trigger automated audits. 3 milliliters of potassium chloride logged out for cardiac resuscitation on Tuesday. The chart said it was used in Bed 9, post-op complication, emergency management. She had access to Bed 9's chart. The note said stable vitals throughout Tuesday. No emergency. No use. 5 milliliters of fentanyl logged out on Thursday morning. The requisition was signed by Dr. James Caldwell, MD, Cardiac Unit Director. The associated patient case note in the computerized system showed a routine pain management protocol for a patient already on extended-release anesthetics. The notation was generic. The dose was excessive. She began photographing the logs with her phone, a small Motorola that had no connection to the hospital's network, keeping the screen dim enough that only the precise numbers appeared in the camera lens. Pharmaceutical inventory log, November 9th. Narcotics disposal record, October 27th. 3 pages. 4 pages. 5. She was focused completely on the numbers, on the pattern beneath the numbers, the way the discrepancies clustered around specific shifts, specific names, specific times when her attendance at the hospital was well documented somewhere else. She didn't hear the footsteps until they stopped directly behind her. Dr. Caldwell stood in the doorway like a man shaped from expensive tailoring and inherited authority. His suit was pressed. His hair was silver at the temples in a way that television suggested meant wisdom. His eyes were the color of a stormy Atlantic, and they were narrowed to slits as he watched her phone lower slowly from the shelf. He didn't move. He didn't speak. He simply looked at what she was holding, at the logs she was documenting, at the evidence she was gathering, at the one nurse on his staff who had noticed the patterns he'd spent for years perfecting. The moment stretched like surgical tape. Brooke turned to face him fully, her body positioning neutral, her expression arranged into professional courtesy. The phone was already in her pocket. Her hands were empty. But the message had been transmitted with a single glance. He knew what she knew, and she knew that he knew. He smiled. The expression didn't reach his eyes. Inventory check. His voice was smooth as oil across water. Standard protocol. She kept her tone level, deferential. The counts on controlled substances looked inconsistent. Wanted to verify the logging system. He stepped into the supply room fully, closing the door behind him with a soft click that sounded like a trigger being pulled. The air pressure changed. Became heavier. He was 47 years old with a salary somewhere in the 6-figure range, 3 ex-wives, and a gambling problem he'd hidden from the medical board using a private account in Aruba. He also had a brother-in-law who was a hospital administrator with hiring and firing authority that extended even to nurses he'd never met. What he didn't have was any concern about a night shift RN who'd been at Seattle General for 8 months. No reputation. No allies. No history anyone could trace. The system is fine, he said, moving closer. Inventory is fine. The logging is fine. Each word landed with the weight of institutional authority. Perhaps you should focus on the patients instead of keeping track of pharmacy business that isn't your concern. He wasn't raising his voice. He wasn't threatening her outright. But there was something underneath the words, a cold recognition that she'd seen something he'd wanted hidden, and now there would be consequences for her noticing. Brooke held his gaze for 2 seconds longer than was necessary, then looked down at the shelves beside her. "You're right, Doctor. My apologies. I should have checked with you first." The submissiveness in her tone was perfect. Rehearsed across 100 similar conversations with officers who demanded compliance and received it. What she didn't show him was the calculation behind her eyes, the way her mind was already reorganizing itself around what had just been confirmed. Dr. Caldwell was stealing pharmaceuticals. He was doing it systematically. And he now knew that someone had noticed. She left the supply room ahead of him, letting him pass through the doorway first, maintaining the hierarchical distance. Back in the cardiac unit, she finished her medication rounds and settled into the nurse's station with her charting, her fingers moving across the keyboard with mechanical precision. By 4:33 a.m., the unit was quiet again. Most patients were sleeping. The night sky over Philadelphia was the color of wet asphalt. She'd made it back to her apartment by 7 a.m., removing her scrubs with the same care she used to remove tactical gear in a field hospital, peeling away the outer layers to reveal the underneath. The titanium rod in her leg hummed with a dull ache that had become familiar as her own heartbeat, phantom pain from a blast that had detonated 147 meters away, that had sent shrapnel through her left leg like bullets through water, that had destroyed the career of a field surgeon named Major Brooke Sullivan and rebuilt her as someone else entirely. She hung her scrubs on the bathroom hook and changed into civilian clothes, jeans, a loose sweater, nothing that suggested military discipline or medical precision. Then, alone in her apartment with the doors locked and the curtains closed, she removed her jacket. Inside the lining, sewn with careful stitches, was a unit patch. Faded from sand and sun and repeated washing. The colors had bled slightly into each other after merger. The insignia of the Naval Special Warfare Command Surgical Team, 3rd Rotation, the patch that identified her as part of the most decorated combat surgical team in Navy history. The patch that represented 847 lives saved in a 16-month deployment. The patch that had cost her everything. She pressed her hand against it, feeling the fabric through the jacket lining against her ribs, and for a moment the apartment was quiet enough to hear her own breathing, steady and controlled, the breathing of someone who'd learned to survive in silence. The next morning, or rather, the same morning, since night shift blurred into day shift in ways that only people who worked them understood, she began a routine that would take 3 weeks to complete. She downloaded copies of every pharmaceutical log going back 6 months. She cross-referenced them against patient charts. She documented the pattern, small amounts consistently logged out, amounts that fit beneath audit thresholds, amounts that corresponded with specific shifts. She wasn't gathering evidence for law enforcement. Not yet. She was gathering confirmation. She needed to understand the scope of what was happening before she decided whether this was the hill she was willing to die on. Because she already knew, with the bone-deep certainty of someone who'd survived a blast that was supposed to kill her, that once she made this evidence visible, there would be no hiding again. Not at Seattle General. Probably not in Philadelphia. Possibly not anywhere that still carried her face and her story. But that realization didn't slow her down. If anything, it made her more methodical. More careful. More thorough. Because if she was going to burn this bridge, she was going to make sure Dr. Caldwell went down with it. The overhead page crackled at shift change, and every conversation on the cardiac floor stopped. Nurse Nightingale to administration. Nurse Nightingale to administration. The mocking nickname hung in the air like a slap. Dr. Caldwell's voice dripped with mock sweetness through the speaker system, ensuring the entire unit heard her summoned like a wayward child. 2 residents exchanged glances. A patient's family member smirked in the hallway. Brooke finished documenting her final vitals from the night shift without looking up, her hand steady as surgical steel, but everyone watching knew what that page meant. She was being called to account. She was being humiliated in front of witnesses. She was being reminded of her place. She took the stairs instead of the elevator. The rebuilt titanium rod in her femur ached with each step, always did after 12 hours on her feet, but she'd learned pain was just information, and right now every signal her body sent her was clarity. The familiar ache grounded her. By the 3rd landing, her breathing had returned to baseline. Composure was a tactical skill like any other, and she'd spent 18 months perfecting it in the shadows of this hospital, invisible, documenting discrepancies while Dr. Caldwell built his empire of diverted pharmaceuticals and falsified logs. Now he was going to confront her. The supply closet door was open when she arrived, and Dr. Caldwell stood waiting inside, his frame filling the doorway with the kind of calculated menace that came from knowing he controlled every variable in the room. He closed the door behind her. The confined space smelled of antiseptic and his cologne, expensive, overwhelming, the scent like a predator marking territory. He stood too close. Deliberately. His voice when he spoke was deadly calm, the kind of quiet that carries more weight than any shout. You've been accessing restricted pharmaceutical logs, Sullivan. The ones in the locked cabinet. The ones that aren't part of your duties. His finger tapped her personnel file. He held it like a weapon. I've been thinking about your application to cardiac nursing. Wondering what made you so interested in post-op medication reconciliation. He smiled. His teeth were white and even. And then I realized something. You have PTSD from a vehicle accident, don't you? Discharged from active duty 18 months ago. The mind plays tricks after trauma like that. Makes nurses see patterns that aren't there. Conspiracies. He opened the file and rotated it toward her. I already have psychiatric transfer paperwork drafted. One phone call to Mercy General's psychiatric unit, and you're gone by end of shift. Or. He paused. Let the silence breathe. You stop. You apologize. You forget what you think you found. Brooke took one measured breath. Her hand moved instinctively to her jacket lining, where the faded unit patch from Marja was sewn inside the fabric, felt its edges against her ribs like a heartbeat that belonged to someone else, someone stronger, someone who'd held steady while mortars fell and men screamed for help. One tear escaped without permission, traced a line down her cheek. She wiped it away without breaking eye contact. Her voice when she spoke was flat, empty of emotion, a statement of fact delivered in the voice of someone who'd already survived the worst the world had to offer. I've survived worse from better men. She turned and walked out of the supply closet. Her cardiac unit badge was clipped to her pocket. She didn't look back. But that wasn't the worst part. Before her next shift, she arrived at Seattle General at 6:27 a.m. for a 7 a.m. report. The parking lot was still dark, the pre-dawn air carrying that particular chill of late autumn in Philadelphia, rain threatening in the clouds above. She was walking toward the employee entrance when Dr. Caldwell intercepted her in front of the incoming team, 6 nurses and 2 residents gathering for morning report, their coffee cups steaming, their eyes fixed on the path ahead because everyone knew what was about to happen. Everyone had heard the page yesterday. Everyone understood the mechanics of institutional power. He reached out and simply unclipped her cardiac unit badge from her pocket. The small motion carried the weight of a ritual. His hand was already moving for her credentials, his voice pitched to carry across the entire gathering. Effective immediately, Sullivan, you're reassigned to patient transport. Full facility, all departments. Your access to medication records is revoked. He held the blue cardiac badge up to the light, then switched it for a yellow transport badge, the color of the invisible, the color of the people who moved bodies between departments without asking questions. Your clinical judgment has been concerning. We've decided a change of environment would be beneficial for everyone. He clipped the yellow badge to her scrubs like pinning a scarlet letter to her chest. The clip was cold against the fabric. Someone coughed. No one met her eyes. The incoming nurses suddenly found their coffee very interesting. One of the residents stared at the ground. Brooke looked at the yellow badge on her chest. She looked at Dr. Caldwell's face, saw the satisfaction there, the confirmation that he'd successfully diminished her, that he'd taken the woman who'd been documenting his crimes and reduced her to wheeling unconscious patients between radiology and physical therapy. She said nothing. She turned and walked toward the staff locker room to change into transport scrubs. Her rebuilt leg ached with each step. The trembling wasn't fear. It was restraint. It was the particular kind of calm that comes from knowing exactly what you're going to do next and having the discipline to wait for the right moment. Behind her, she heard Dr. Caldwell laugh to one of the residents. Sometimes these people need clear boundaries, he said. They misunderstand their position in the hierarchy. 3 days. That's all it took to understand the full architecture of what Dr. Caldwell had built. Brooke spent 72 hours wheeling patients on a transport stretcher between departments. Radiology on the 2nd floor. Physical therapy in the basement. ICU on the 4th floor. Discharge waiting in the lobby. Her rebuilt leg screamed by hour 6 each day, the titanium rod in her femur pulsed with a rhythm that felt like a metronome counting down something inevitable. But she pushed the stretcher, said nothing, smiled when family members thanked her, and watched. Always watching. From her new position in the shadows, she could see the full pattern now. Dr. Caldwell had reassigned 2 other nurses who'd worked post-op alongside her. Both of them had been documenting medication discrepancies. Both of them had transferred out within days of Brooke's demotion. He'd altered the medication room access log to exclude the 2nd shift, the night shift when he was rarely present but when the largest quantities of controlled substances were dispensed. He'd rerouted the pharmacy order fulfillment through a direct line that bypassed the standard verification system. He was methodical, strategic, surgical in his precision. He was covering tracks, and she realized with the clarity of someone who'd run trauma bays under fire that she'd only been looking at the surface of his operation. On Thursday at 11 p.m., the ambulance bay doors burst open like a percussion blast. Paramedics rushed a gurney through the entrance, and the sound of their voices carried urgency and trajectory, the controlled chaos of an emergency moving at speed. Inbound, 2 minutes, dispatch had called earlier, but this was different. This was a critical arrival. Brooke was wheeling a post-op patient back to a surgical floor when the bay doors opened, and she caught the uniform, a navy dress blues, the fabric cut away in strategic places where EMS shears had removed it to access vital signs. Her breath stopped. Literally stopped. The world compressed into a single moment of recognition. Captain Raymond Torres, 58 years old, massive pulmonary embolism in transit from a Navy retirement ceremony, the lead paramedic shouted, moving in practice tandem with the receiving trauma team. Presentation began approximately 40 minutes ago. Chest pain, shortness of breath, hypoxic. Blood pressure 90/60 and dropping. Right-sided lung involvement confirmed on field assessment. He's flagged for MRSA exposure, admitted to VA hospital 3 weeks ago for surgical follow-up. Contaminated case. Full isolation protocol required. The name hit her like a physical force. Captain Raymond Torres. The man whose signature appeared on her discharge papers 18 months ago. The man who'd court-martialed her for disobeying direct orders to leave the wire, for saving 3 Marines pinned by sniper fire in Marja, for making a command decision that violated the tactical parameters of her assignment. She'd held steady while he read the charges. She hadn't trembled. She hadn't cried. She'd simply stood at attention while he announced her medical discharge, effective immediately, no appeal, no reconsideration. The titanium rod in her femur was the only visible reminder of what she'd lost. Everything else she'd buried. Now his chest was heaving, his eyes closed, his hand gripping the stretcher rail as paramedics moved him toward trauma. Brooke's transport cart was directly in the path of the gurney. She wheeled it out of the way, but not before she saw his face fully, the sharp jawline, the tension in his features, the way his jaw clenched against pain. It was him. Absolutely, unmistakably him. Dr. Caldwell appeared in the trauma bay doorway as the team rushed Torres toward isolation. He read the chart as it moved past him, his eyes tracking the MRSA notation, his face hardening like concrete setting. Isolation room 4, he commanded, his voice carrying the weight of someone accustomed to obedience. Minimal staff contact. Full PPE protocol. Dr. Reynolds will handle this remotely from the office. No need for direct intervention. But Dr. Reynolds was already shaking his head, stepping backward, already articulating his excuse before anyone asked. My daughter. Immunocompromised. I can't risk contamination at home. I have to recuse myself. One by one, the cardiac team found reasons to step back. A rotation ending early. A sick child. A compromised immune system. A vacation already scheduled. Careers didn't survive contaminated cases that deteriorated. If Torres crashed, if the isolation protocol failed, if the resistant infection spread, the staff would be blamed, not the physician who'd assigned them to a case he deliberately avoided. The mathematics of hospital politics was brutal and perfectly clear. Brooke watched it happen from the hallway, still in her yellow transport badge, invisible, forgotten, exactly where Dr. Caldwell had put her. The team scattered like birds fleeing a gunshot. Torres's stretcher disappeared into isolation room 4. The doors sealed behind him. And for the first time in 72 hours, Brooke smiled. A small smile. A cold smile. The kind of smile that appears when someone finally understands the precise geometry of what needs to happen next. She had for minutes before her shift ended. She had for minutes to change out of her transport scrubs and clock out and walk toward the staff locker room, where she'd be completely alone. And she had 4 minutes to make a decision that would change everything. She felt the unit patch against her ribs as she moved through the hallway. Her hands were steady. Her breathing was baseline. She was about to violate every protocol that had kept her safe in this hospital, about to risk the careful anonymity she'd maintained for 18 months, about to step out of the shadows and into the light, but only if she walked back into that trauma bay and did what every physician in the building had refused to do. Captain Torres was dying. Dr. Caldwell had abandoned him. And the woman who'd been sentenced to push a transport stretcher just happened to be the only person in Seattle General qualified to keep him alive. The third day of pushing stretchers felt like a countdown nobody had warned her about. Brooke's hands gripped the transport cart handle at 6 in the morning, guiding Mrs. Chen from the cardiac observation unit down to radiology for her stress test. Through the doorway as she passed, she caught a glimpse of Dr. Caldwell reviewing a chart, his posture relaxed, his power complete. She'd been walking these same corridors for 8 months as a nurse. Now she moved through them as a ghost in the hospital's infrastructure, visible, functional, invisible. By hour 6, her rebuilt leg was telling her stories. Not pain exactly. Pain was information, and she'd learned to translate it the way soldiers learn to read wind before firing. The titanium rod that ran from her knee to her hip had been fused with bone 18 months ago in the surgical theater at Landstuhl Regional Medical Center. The surgeon said she'd never walk without a limp. She hadn't told them about the 3 Marines she'd carried out of Sanjin Valley before the IED took the road apart beneath her feet. She'd never told anyone. The prosthetics unit at Walter Reed had measured her gait, documented the permanent shortening, prescribed physical therapy that she completed with the same silent determination she brought to everything else. By the afternoon of day 3, standing still was harder than moving. Standing still meant thinking about what she'd built here, what she'd lost to Caldwell's hand on her badge. A quadriplegic man named Jerome needed to go to physical therapy on the 2nd floor. Brooke wheeled him through the elevator, and he talked about his daughter's soccer tournament while her mind tracked the numbers. 73 patients transported. 432 minutes of hallway time. 216 opportunities to see through the glass walls of the cardiac unit where Dr. Caldwell moved between rooms like a general surveying his kingdom. He wore his competence the way generals wear medals, visible, weighty, designed to be noticed. 3 days and he hadn't looked at her once. That was the real punishment. Not the demotion itself. The erasure. The message delivered without words, "You don't exist in my space anymore." At midnight on day 3, Brooke was signing off her transport logs when the overhead speakers crackled. Code yellow to isolation room 4. Respiratory distress. Possible DVT. The words registered before the meaning did, and then the meaning hit like a current reversing. She looked up from the clipboard. The elevator doors were already opening. They wheeled in a Navy officer on a stretcher, his skin the color of old concrete, his breathing coming in short, sharp bursts that sounded like a mechanical pump failing. Oxygen mask. For lines already placed. A nurse she didn't recognize was running beside the gurney, calling out vitals. The patient's chart was flagged in red. Resistant infection. Career risk. Do not approach. And then she saw his face. Captain Raymond Torres. The man who'd sat across from her during a formal court-martial hearing 18 months ago in a tent at FOB Shank, his uniform pressed, his expression carved from ice. The man who'd called her decision to save 3 Marines outside the wire glory-seeking. Reckless. A trauma surgeon playing soldier when she had patients depending on her inside the surgical facility. The man who'd recommended her discharge papers be processed immediately for medical unfitness and psychological instability. She'd stood at attention for 2 hours while Torres and 2 other officers reviewed the evidence that she'd disobeyed direct orders. She'd said nothing in her defense. The 3 Marines she'd saved, Rodriguez, Holloway, Mercer, were back in the States recovering. One of them had lost his left arm below the elbow. The other 2 carried shrapnel wounds that would take years to settle. They were alive because she decided that orders mattered less than breathing human beings bleeding out 400 meters beyond the perimeter. Torres had decided she was a danger to her unit. The discharge papers had been signed 3 days later. Now he was in isolation room 4, and she could see through the glass partition that his pressure was dropping. 85/55. then 80/50. The attending physician appeared on the monitor, gave orders from a distance, anticoagulation therapy, nothing invasive, we'll send someone in the morning, and then the monitor screen went dark. Nobody was going in. Nobody was going to touch a patient flagged with a resistant infection, and no attending physician willing to risk his career on a contaminated case. The clot was fragmenting. She could read it in the arrhythmia climbing across his monitor. The pieces were breaking off and traveling, moving toward his lungs, toward his heart. 12 hours until the consultant arrived from St. Catherine's. Torres wouldn't survive 12 hours. Brooke changed out of her yellow patient transport scrubs at 1:45 a.m. The locker room was empty, fluorescent lights humming their anxious song above the benches. She reached into the left-hand pocket of her jacket and felt the unit patch beneath her fingers. Faded now. The embroidery had worn to soft threads. The patch showed the silhouette of a combat medic with a lightning bolt, the insignia of the 2nd Battalion, 3rd Marine Regiment, 3/3, the unit she'd served with for 4 years before her knee decided to quit. She pressed her palm against the jacket, feeling the patch through the fabric. 3 Marines. Rodriguez. Holloway. Mercer. She changed into fresh scrubs with the authority of someone who belonged, her movements sure and precise. The scrubs didn't ask questions. The badge on her coat was yellow, downgraded to transportation logistics. But transportation logistics meant she had access to every hallway, every elevator, every isolation room in the hospital. It was a glitch in the system. An oversight that someone should have caught months ago. Nobody had. At 1:58 a.m., she stood outside isolation room 4. Through the glass, Torres lay motionless. His chest rose and fell in the shallow rhythm of a body starting to fail. The monitor showed his oxygen saturation at 88% and falling. His heart rate was climbing. 140. 145. His pressure had dropped to 70/45. The new arrhythmia wasn't a question anymore. It was a statement. The clot was fragmenting. The pieces were traveling. The clock was running backward. Dr. Caldwell appeared beside her so quietly that the air itself seemed to compress. His presence was like a hand tightening around her throat, not aggressive yet, just a warning of what aggression would feel like. "Your transport staff, Sullivan," he said, his voice the sound of authority delivered at exactly the correct volume to break human beings. "This patient is flagged and off limits. I've already called Dr. Morrison from St. Catherine's. He'll be here at noon. 12 hours. She didn't say it aloud. The words would have been insubordination, and insubordination was the one thing left that Caldwell could control. "He needs intervention now," she said quietly. Her voice was still deferential. Still asking permission. Still small. Caldwell's hand went to his phone. "If you enter that room without authorization, I will have security remove you from this building permanently. I will personally call the State Medical Board. I will ensure you never work in healthcare again." He was speaking in the absolute certainty of someone who'd made 3 phone calls already, the first to security, the second to hospital legal, the third to the medical board. He'd already documented her insubordination. Already prepared the termination paperwork. Already moved 3 strategic pieces ahead. He was competent. That was what made him dangerous. That was what made him certain he'd already won. She watched Torres's chest rise and fall, each breath more laborious than the last. The oxygen mask wasn't delivering enough. His body was running out of time. The numbers on the monitor were screaming if anyone had bothered to listen. Brooke had her yellow transport badge in her hand before she made the decision to move. The badge shouldn't grant isolation room access. It was designed for movement of patients, not for entering contaminated rooms. But there was a glitch in the system, an oversight in the programming that allowed transport staff to open any door when a patient needed moving. The system didn't require identification. It just required a badge with the right color code. She swiped. The lock clicked open. The sound was small and final and irrevocable. Dr. Caldwell's face went white, not with anger, that came later, but with something deeper. With the understanding that she'd just called his bluff. That she'd walked through the door he'd told her she couldn't open. That she'd disobeyed him in the most public and visible way possible, in front of the monitors and the cameras and the testimony of the hospital's own systems. She stepped into isolation room 4. The temperature changed immediately, the air going colder and cleaner and thick with the smell of antiseptic and something else, the copper undertone of blood oxygen dropping. Torres was on his back, unconscious, his right hand draped across his chest. His navy tattoo was visible on his forearm. An anchor and 3 letters. TAD. Tour of active duty. His pressure was 68/40 now. His oxygen sat was 84% and dropping. The monitor was no longer just alarming. It was screaming. She moved to his side without hesitation, her hand steady as surgical steel, her mind already running through the protocol that was burned into her muscle memory from 4 years and countless cases in a surgical tent under mortar fire. She'd held 3 Marines together with her hands while rounds came through the canvas walls. She'd compressed chests and pushed drugs and commanded people who outranked her because the rank didn't matter when someone was dying. Now she was moving through the same precision, the same absolute clarity that came when the world stripped away everything except the patient and the clock and the knowledge that she was the only person in the room who could keep someone alive. Behind her, through the glass, Dr. Caldwell was already reaching for his phone. The monitor flatlined at 2:41 a.m. One moment Captain Torres was breathing, shallow, labored, the ventilator wheeze filling the isolation room like a metronome counting down. The next moment the rhythm collapsed into a single catastrophic line. Brooke heard it from the nurse's station where she'd been standing watch, the high-pitched alarm cutting through the silence like a blade. She moved before conscious thought could catch up. The corridor was empty. Dr. Caldwell had made sure of that. 3 phone calls, 2 administrative orders, 1 carefully worded email sent to every attending physician. Captain Torres presents with resistant infection and high-risk antibiotic complications. Recommend minimal contact for personal safety. Direct supervision by designated staff only. Translation: don't touch him. Your career isn't worth it. The isolation room door hissed as it sealed behind her. Torres lay motionless under the overhead lights, his oxygen mask fogged and still, his left arm pale against the white sheet. The central line, inserted 16 hours ago, was his only lifeline now, the anticoagulant drip running at a steady 12 milliliters per hour, thinning his blood, fighting the clot that had already tried to kill him once. But clots don't stop trying. They shift. They grow. They search for new places to embed themselves like seeds finding cracks in concrete. Brooke's hands were already moving, gloved, sterile, precise as surgical instruments. She adjusted the monitor leads, checking each one for drift, and saw what the cardiac unit had missed. The pressure reading wasn't dropping evenly. It was cascading. His systolic was 70 and falling, his diastolic barely visible on the screen. The clot had shifted position. Not his lungs this time. His heart itself. A PE in the pulmonary arteries meant the blood couldn't reach his lungs to oxygenate. But a clot lodged in the right ventricle meant his heart was trying to pump against an obstruction it couldn't overcome. His heart was failing. 12 hours. That's what she had before permanent damage. 12 hours before the muscle would start to necrotize, before the arrhythmias would turn into cascading death, before every intervention became palliative care and morphine drips. She grabbed the medication cart, fingers finding the anticoagulant bottles by muscle memory. The doses were wrong. Anyone with 16 months in a field hospital would have seen it instantly. The cardiac team had been running therapeutic levels, blood thinners that would prevent new clots but wouldn't dissolve the existing one fast enough. Brooke recalculated on her phone, heparin load of 80 units per kilogram, pushing the anticoagulation levels into the aggressive range. Her hands measured and pushed the medications with the same focus she'd used in Marja when artillery rounds shook the walls, and she had 30 minutes to save a Marine's shattered abdomen before the medevac bird landed. Hour 1. O2 sat at 88. Elevated but manageable. his heart rate compensating, working harder to push blood through the obstruction. Every beat costing him more energy. She marked the time on the whiteboard, 2:11. Start. The fluorescent lights hummed above her head, that distinctive hospital sound that never quite went away, the electronic pulse that outlived everyone it illuminated. By hour 3, something had shifted. His labs came back. She'd snuck a sample to the lab tech on the 3rd floor, someone who didn't ask questions when she wore her borrowed credentials. The clot wasn't dissolving. It was organizing, becoming more solid, more permanent. She could feel his fever through the thermal imaging on the monitor, 37.8 degrees Celsius and climbing. His white blood cell count was spiking. The infection flag wasn't just bureaucratic theater anymore. Torres's immune system was responding to tissue damage, to the infarction beginning at his heart's periphery. Hour 4 brought the critical moment. His left pupil dilated a fraction more than his right. Just a millimeter. Just enough that someone paying attention would notice. Brooke noticed. She noticed the temperature spiked to 38.1 degrees, the way his breathing became more labored despite the ventilator support, the subtle decrease in oxygen saturation from 88 to 84. A second clot. Not forming. Formed. Somewhere new, somewhere worse. She reached for her phone to call for imaging. The order went to the system. And then, nothing. No acknowledgement. No tech response. She called the radiology department directly. The line rang 4 times before a tired voice answered, "Radiology, this is Chen. Stat ultrasound on isolation bed 3, Captain Torres. Possible PE progression." A pause. She could hear the keyboard clicking. Then, "I'm sorry, I don't have authorization for that room." Dr. Caldwell flagged all imaging requests for that patient. Only physicians can order direct. "You'll need to contact." Brooke hung up. She didn't need to contact anyone. She already knew the answer. Caldwell had locked down the imaging like he'd locked down the medications, the staffing, the hope. She moved to the supply cabinet. Her hands knew exactly where to find it, the portable ultrasound unit, the one used for emergency bedside diagnostics when time didn't permit waiting for the radiology suite. She'd used one in Marja when the generators failed and the power grid in the FOB went dark for 16 hours. You learn to work with what you had. The ultrasound transducer was cold against Torres's exposed chest. She found the 4-chamber view with the ease of a pianist finding middle C, her muscle memory precise as a metronome. The right atrium was dilated. Badly. The right ventricle was straining, its wall becoming thicker with each frustrated contraction, trying to force blood through an obstruction it couldn't overcome. And there in the pulmonary artery, a new shadow. Not as large as the first, but positioned directly across the main trunk. A widowmaker. The name existed in the lexicon of emergency medicine for a reason. Hour 7. She'd adjusted the heparin 4 times now, pushing the anticoagulation into dangerous territory. At this level, if she was wrong about the clot size, he'd bleed out before the drugs wore off. Internal hemorrhage. Exsanguination. Death that would come quietly, a slow pressure drop, his organs shutting down one by one as the blood they needed never arrived. But if she didn't push it hard enough, the clot would organize completely and become inoperable. A time bomb with a fuse that was burning down. She sat beside his bed during hour 5, her hand on his full line, monitoring the pressure reading like a hawk watches prey. Her leg ached, the titanium rod in her femur responding to the cold of the isolation room, the metal conducting cold differently than bone. She ignored it. Pain was information. Pain was data. Pain told you what was failing and where. Hour 8. Torres's temperature had reached 39.2 degrees. Fever spiking. His body fighting something it couldn't win. The infection was real, but it wasn't the primary threat anymore. The clot was. The clot was going to kill him, and it was going to do it in the next 4 hours if she couldn't stop it. She prepared the thoracotomy kit while watching his heart fail. Scalpel. Chest retractor. Curved clamp. Sutures. Field kit, the kind she'd carried in Marja in a tan canvas bag that had absorbed 3 years of dust and blood and the particular iron scent of field medicine. The kit was in the supplies closet, stored for surgical teaching demonstrations. Nobody had missed it yet. Nobody was watching her closely enough to notice. Hour 9. 3:53 in the morning. 14 hours since Torres arrived. 13 hours since Caldwell had ordered everyone away from him. The monitor gave its final warning, not a flat line, but something worse. Ventricular fibrillation. Quivering. His heart was no longer pumping, it was just spasming uselessly, like a fist repeatedly clenching and unclenching. No output. No perfusion. The oxygen in his blood wasn't reaching his brain, wasn't reaching his organs, wasn't doing anything except slowly killing him. 30 seconds until brain death began. 60 seconds until it was irreversible. Brooke didn't call for help. There was no help to call. The crash cart was locked in the physician's access closet, restricted by Dr. Caldwell's administrative order. The defibrillator was in the same place. External cardiac massage would buy her maybe 90 seconds, but Torres needed perfusion now, oxygen getting to his heart and brain while she figured out what was blocking the pulmonary artery. She needed to touch his heart. Her hands moved with the precision learned in a tent at Forward Operating Base Marja, under the light of a camp lantern when the generators failed, with mortar rounds shaking the walls and a Marine's chest cavity open to the desert air and her fingers the only thing keeping him alive. She opened the thoracotomy kit with one motion, her left hand already preparing his chest wall, feeling for landmarks, the spaces between ribs, the precise anatomical roadmap that lived in her muscle memory. The scalpel cut clean. Left anterolateral thoracotomy. The incision from the 4th intercostal space down to the 6th, precise as surgical markers could guide. The blade moved like it was following a groove worn into the world itself. Blood welled immediately, the tissues were vascular here, near the heart, near the arteries that fed the lungs. She ignored it. The chest retractor went in, spreading the ribs, the metal spreader cold against the exposed interior cavity. Torres's heart was in front of her. Quivering. Useless. Dead. Her right hand found the myocardium. The muscle was warm, still alive even as it failed, and she began compressions. Direct massage. Her fingers curved around the left ventricle, and she compressed rhythmically, manually pushing blood where Torres's own heart could not. 1. 2. 3. Pumping. Forcing oxygenated blood back into circulation while her left hand worked the field ultrasound probe around the pulmonary artery, finding the clot, identifying its exact position. The clot was blocking the main trunk of the pulmonary artery. Massive. Organized. Concrete hard. No amount of heparin was going to dissolve it. She needed to remove it. Minute 2. His heart gave a flutter, then caught. A beat. Weak, but real. She felt it synchronize with her compressions, felt the cardiac rhythm return to something vaguely organized. The monitor sprang back to life, not normal, but activity. Electrical activity. The possibility of life. She worked with the curved clamp, positioning it across the pulmonary artery while her right hand never stopped, compress, release, maintaining perfusion, keeping his heart and brain alive while she performed surgery with one hand. The clot came free in one piece. Massive. The size of a grape. The size of everything. She held it up, a dark, malignant thing suspended between her fingers, and dropped it into a specimen cup. Her right hand resumed compressions. The monitor showed normal sinus rhythm now, real beats, Torres's own heart taking over, pushing on its own power. She felt it quicken, strengthen, find its rhythm. Sutures. Her fingers were already moving, closing the artery with microscopic stitches, the kind that took twice as long but left minimal scarring. The kind that saved lives and careers. For stitches. 5. Each one tight and perfect, the knot work of someone who'd done this hundreds of times under conditions infinitely worse than a controlled hospital room. The chest wall closed next, muscle layer, then skin. Her stitches were beautiful, the kind of work that looked like artwork instead of surgery. 11 minutes from flatline to closure. The entire procedure, start to finish, performed with one hand while she manually maintained his cardiac output with the other. Torres's O2 sat at 92 now. Rising. His heart rate steady at 98. His blood pressure climbing back toward the living. The fever was beginning to break, not immediately, but she could feel it, sense it in the thermal readings, the way his body was responding to intervention instead of spiraling into shutdown. She changed into new scrubs, the old ones were stained with blood and plasma. Her hands trembled for exactly 2 seconds, the adrenaline catching up with her central nervous system, and then she stilled them through sheer force of will. The composure that had kept her alive in Marja, the calm that had made her the one Marines trusted with impossible things, settled back into her shoulders. By 5:56 a.m., Torres was stable. O2 sat at 96. Heart rate steady. Temperature beginning to normalize. The infection was still there, that was a fight for another day, another shift, another set of antibiotics, but the immediate death sentence had been commuted. The isolation room door opened at dawn. Dr. Caldwell stood in the doorway, his expression shifting from curiosity to confusion to something that looked like rage if rage could go white and silent and deadly. His eyes moved from Torres in the bed, breathing, stable, alive, to Brooke in her new scrubs, back to Torres, then down to the surgical kit on the beside table. The scalpel was still there. The chest retractor. The curved clamp. Evidence of her transgression. His mouth opened. Closed. His hands were shaking, but not with anger. With fear. The fear of a man watching his own career implode in real time, watching someone do what he deliberately prevented, watching a patient live who was supposed to die. "What did you do?" His voice was barely audible. Brooke didn't answer. She began cleaning the surgical instruments with methodical precision, her movement steady as stone. The captain was stable. The clot was removed. The bleeding had been controlled. The medical facts existed now, independent of his approval. "You don't have credentials to perform." "Captain Torres is stable," Brooke said. 8 words. Flat. Empty of anything except information. His O2 is 96. His heart rate is 98. He's responding to antibiotics. Caldwell's hand was already moving toward his phone. She watched him pull it out, watch him dial, watch the color drain from his face as he realized what he was about to do. He was about to call the medical board and report that a nurse had performed a field thoracotomy in the middle of the night. He was about to report that she'd saved a patient he deliberately tried to kill. He made 3 calls before noon. Brooke could hear him from the staff lounge, his voice calm and methodical and desperately careful, each sentence crafted to bury the truth under layers of medical bureaucracy. First call to the medical board. Second to HR, third to a number he didn't speak aloud but pronounced slowly into the phone, Naval Medical Review Board. "I need to request the complete service record for a former employee." The words hung in the air like smoke. By 2 p.m., security was waiting at her locker. 2 uniformed officers and a woman in business clothes holding a folder marked termination. Brooke didn't resist. She changed out of her scrubs, the ones without the captain's blood on them anymore, and walked to the staff laundry room where she'd begun her shift 8 months ago, when nobody knew who she was and the unit patch sewn inside her jacket lining was nothing but a ghost she carried. She folded the blood-stained scrubs one final time. The weight of the moment pressed down on her shoulders like sandbags, like the rifle she'd carried for 16 months, like the final indignity of walking away from a life she'd rebuilt from nothing twice now. The laundry attendant didn't look up. Nobody ever did. Brooke was just the transport nurse, just the demoted staff member, just the nothing that hospitals chewed up and threw away when they were finished using you. She set the scrubs in the return bin and walked out into the Philadelphia morning. It was raining, the kind of steady, cold rain that hammered the parking lot like judgment, like the sky itself was disappointed. Behind her, in the isolation room, Captain Torres was alive. His heart was beating. The clot was gone. He'd have scars now, and questions, and a recovery that would take months. But he would recover. And the woman who'd saved him was already unemployed. Dr. Caldwell made 3 phone calls before noon. The first landed on the medical board's compliance desk at 10:33 a.m., his voice steady and measured as he documented Brooke's unauthorized thoracic procedure performed without attending physician oversight, without proper surgical clearance, without the safeguards that kept people alive instead of dead on operating tables. He used words like reckless and protocol violation and patient safety risk, each one a carefully placed brick in a wall meant to bury her. The compliance officer typed as he spoke, not knowing that the woman he was describing had spent 18 months learning to breathe again through titanium and rage. The second call went to HR at 11:15 a.m. Caldwell requested immediate termination paperwork, citing the unauthorized procedure, the trespassing into a contaminated isolation room against direct orders, the insubordination documented in his own handwritten notes. He had evidence. He had witnesses. He had the authority of a department director and the institutional weight of Seattle General behind him. The HR director promised the paperwork by end of business. The third call came at 11:52 a.m. Caldwell's voice dropped lower, more intimate, speaking to a contact at the Navy Medical Review Board, a favor owed from years back, a call he'd been saving for exactly this moment. He requested Brooke Sullivan's full-service record, her medical discharge paperwork, the classified details of her Marja deployment. He didn't ask for much. Just enough to understand who she really was, enough to find leverage, enough to ensure that even if the hospital didn't destroy her, the Navy would finish the job. What Caldwell didn't know, what no one in those offices understood yet, was that his 3 phone calls had just triggered the mechanism that would dismantle him completely. Brooke Sullivan stood in the staff locker room with blood still drying on her scrubs. The stains ran from collarbone to hip, Captain Torres's blood mixed with her own sweat, the color of 12 hours underwater where nobody could see you drowning. She peeled the fabric away from her skin slowly, each movement controlled, her jaw tight. The scrubs fell into a heap at her feet, and she stood there in the harsh fluorescent light wearing nothing but the faded unit patch sewn inside her undershirt, her heart rate steady at 62 beats per minute, her hands perfectly still. She turned on the laundry return window faucet and rinsed the blood from her fingers one by one, watching the pink-stained water spiral down the drain. The soap smelled like industrial lie and broken promises. Each drop of water made a sound like a clock counting down, tick, 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 and she understood in that moment that everything she'd rebuilt here in Philadelphia, everything she'd constructed carefully in the dark spaces of night shifts and quiet competence, had just collapsed like a house made of straw. The security escort had been perfunctory. 2 officers in dark uniforms, their body language apologetic, which made it somehow worse. They didn't understand what they were walking out of the building. They thought they were removing a rogue nurse. They were actually removing the only person who'd been trying to save them all. Now she stood at the laundry return window, folding the blood-stained scrubs with the precision of someone who'd once folded maps in a trauma tent while mortar fire shook the walls. Fold. Crease. Fold again. The fabric was still warm. Still wet. She placed it in the bin with the other discards, watched the volunteer worker take it without comment, and walked back through the corridors of Seattle General with her head level and her eyes forward. They didn't know she'd been discharged from the Navy. They didn't know about Marja. They didn't know that the woman they'd just escorted out had held 14 lives together with her bare hands under fire. They knew only what they could see, a nurse, blooded and fired, leaving the hospital with nothing but her badge, already deactivated, and the weight of the faded patch beneath her shirt. She made it to her car in the parking lot before the rain started. It fell hard and fast, hammering the windshield like applause for a performance nobody was supposed to understand. The review board arrived on Tuesday morning in 3 dark sedans, their credentials fresh and their expressions grim. They moved through Seattle General like sharks through murky water, and Caldwell watched them from his office with a smile that had already begun to calcify into a mask. He'd called them. He'd triggered the inspection. He'd been so certain they would vindicate him, so confident in the structure of his narrative. He was wrong. Captain Raymond Torres regained consciousness at 9:44 a.m., his eyes opening to pale sunlight and the soft beep of monitors counting the seconds of his new life. The endotracheal tube had been removed at dawn. His lungs were working. His heart was maintaining its own rhythm without support, sinus rhythm, stable, the kind of rhythm that meant survival. His eye scanned the room slowly, relearning the geography of light and shadow, until they found her. Brooke stood in the corner of the ICU unit where she'd been permitted to give her statement to the board, the only person allowed in the hospital, her presence a complicated legal matter still being negotiated between departments. She was watching Torres with the expression of someone checking vital signs, reading the subtle shifts in his face like a monitor screen. He whispered one word through the oxygen mask, still delivering support to his recovering lungs: Reaper. The room went so quiet you could hear the fluorescent lights hum their low electrical song. Reaper was not her name. Reaper was her call sign from Marja, from the 3rd Battalion, 5th Marines, a dark horse company, from 18 months of trauma bays and impossible choices and hands that had learned to separate the living from the dying in seconds. Reaper because she went into situations where the outcome seemed predetermined and came back with survivors. Reaper because in Marja, she was the person they called when death was already in the room with you. "That's Major Sullivan," a voice said from the ICU entrance. Torres's daughter stepped forward, still in her navy dress whites from the morning meeting with the review board, her shoulders squared with the weight of command and family loyalty. "The trauma surgeon who saved my father's platoon in Marja. She ran a field hospital for 16 months under constant fire. She's earned every scar she carries." The board investigator who'd been taking notes looked up, confused, because the woman in the corner was supposed to be a nurse, a rogue practitioner who'd overstepped her scope, not a decorated field surgeon. The investigator's hands went to the file folder on the ICU counter, the file that had been opened less than an hour ago when the naval attaché arrived with Caldwell's request for Brooke's discharge paperwork. A SEAL team leader pushed through the ICU doors next, his frame filling the threshold like a displacement of air and violence held in check. He came to attention, not casual, but full military bearing, his eyes meeting Brooke's for just a fraction of a second before his voice cut through the room. Major Sullivan earned the Distinguished Service Cross in Marja. She held a trauma bay alone for 12 hours under mortar fire and saved 14 men, including me. He paused. "I was Petty Officer First Class James Mercer. She saved my life when my femoral artery was severed and I was 3 minutes from cardiac arrest." The board investigator's hands began to shake. He opened the file, the real file, the complete file, the one that detailed her 2 bronze stars and the Purple Heart that had come with a medical discharge and a titanium rod in her left femur. The investigator read aloud the citation for her Distinguished Service Cross, his voice cracking on the words "extraordinary heroism" and demonstrated exceptional surgical skill and maintained life support for casualties under sustained fire for 16 consecutive hours. Each medal name felt like a beat in a song that was only now reaching its chorus. Bronze Star. A pause. Bronze Star. Another pause. Purple Heart. The room waited. And then, a Navy Cross. The second highest honor for valor in combat. The silence that followed was the kind of silence that changes things. The kind of silence where truth settles into the spaces where lies used to live. Dr. Caldwell stood at the ICU counter, his face the color of old bone, because he had just understood what he'd done. He'd triggered an investigation into an unauthorized procedure. That investigation had given the board cause to pull her complete service record. Her service record contained documentation of his 3 phone calls, flagged by the Naval Record Center as a security concern, a civilian attempting to access classified military personnel files. The board had cross-referenced those calls with his phone logs. They were looking for his contact. They were already beginning to suspect there was something else. Something worse. The board chairman turned to face Caldwell, and the doctor's back was already moving toward the door before the questions could begin. His hands were empty. His badge was about to be deactivated. His life had exactly enough time to change while he was still standing in this room, still breathing the same air as the woman he'd tried to destroy. Because the moment the hospital's compliance team had pulled his surgical records pulled to satisfy the investigation he'd triggered, they'd found the pattern. 3 years of it. Narcotic diversion across dozens of post-operative cases. Medication logs that didn't match the pharmacy records. Altered notes. Saline injected where hydrocodone and fentanyl should have been. He'd been so careful, so methodical, spreading the theft across enough patients to stay under audit thresholds, except Brooke had been documenting it all those nights in the supply room, mapping the pattern, cross-referencing the logs with post-operative complication rates, understanding something that the computer systems hadn't flagged yet. His own competence had become the weapon that would destroy him. His careful, strategic, methodical approach to theft had created a pattern so precise, so documented, that once someone knew to look for it, it was impossible to unsee. On Wednesday, the state medical board suspended his license pending criminal investigation. On Thursday, the DEA filed federal charges for drug trafficking and distribution. On Friday, Seattle General's legal team announced a settlement with 2 families whose loved ones had died from under-medication post-surgery, deaths caused by Caldwell's diverted pain management, his falsified surgical notes, his decision that his addiction was worth more than their lives. Brooke stood in the hospital lobby on Friday afternoon when they escorted him out, his hands empty of the briefcase he'd carried for 11 years, his badge already deactivated, the card no longer able to open the doors that had defined him. His car keys were in his pocket. His future was a series of legal meetings and psychiatric evaluations and the slow process of losing everything. He saw her. Their eyes met for exactly 2 seconds. She took one measured breath, her hand resting over the place where her faded unit patch sat sewn inside her jacket, right above her heart, the part of her that had never stopped being Major Sullivan even when everyone had agreed to treat her as just a nurse. She didn't smile. Didn't nod. Didn't give him the satisfaction of any expression at all. Just watched him understand that his phone calls, the documented, traceable, recorded phone calls, had been the thing that finally brought the weight of institutional investigation down on his head. He'd been strategic. He'd been precise. He'd been competent. And every ounce of that competence had been turned against him by his own actions. She didn't need to say anything. The understanding in his eyes was enough. 6 months later, someone sent Brooke a photograph through the hospital's internal mail. No return address. Just a manila envelope on her new desk in the Director of Emergency Medicine's office, which overlooked the cardiac unit where she used to work in quiet anonymity during the night shifts. The photo showed Dr. Caldwell sitting behind a folding table at a strip mall medical plaza in South Philadelphia. Behind him hung a banner, Caldwell Insurance Services. His medical license was revoked. His pension had been seized for restitution to the families he'd harmed. His hands rested on pamphlets promising auto coverage and competitive rates. He looked smaller than she remembered. Diminished. The kind of man who'd once filled a room with a weight of authority but now could barely fill a folding chair. She studied the image for a long moment, then stood up and walked to her locker in the physician's break room. The photo went inside, pinned next to a picture from Captain Torres' daughter's wedding last month. Torres stood in his dress whites, his hand on Brooke's shoulder, both of them finally standing at ease, finally on the same side of history. His daughter had married a lieutenant commander from the Naval Academy, and Torres had given Brooke a photograph as thanks, the kind of thank you that acknowledged something deeper than gratitude. It acknowledged the reckoning. It acknowledged that the court-martial had been wrong. It acknowledged that the woman he'd court-martialed for breaking protocol to save lives had proven, in the end, that she understood the protocol better than he ever could. That saving lives was always the protocol that mattered most. The hospital had reinstated her with full back pay and then promoted her, after the board reviewed her surgical outcomes from Marja and realized what they were looking at, a 96.3% survival rate from a forward operating base under mortar fire. Innovation she'd developed for field trauma care that had been adopted by trauma centers across 3 continents. A woman who'd walked back into a hospital as a patient transport specialist because she'd been broken and needed to rebuild, and who had rebuilt herself so quietly and so completely that nobody noticed she was walking around carrying every skill that could save their lives. Her office door closed softly behind her. The faded unit patch hung framed on the wall, finally not hidden anymore, no longer sewn inside anything but displayed where the light could find it. Her rebuilt leg still ached after long shifts. She still worked nights sometimes, by choice now, moving through the emergency department with the same steady hands and quiet competence that had earned her respect 8 months ago. But now when she entered a trauma bay, people stepped aside. They knew what the limp meant. What the patch represented. What those 12 hours in isolation room for meant, that the measure of a healer isn't in the protocol they follow, but in the lives they refuse to let slip away, even when everyone else has found reasons to walk away. She touched the framed patch one last time, her scarred fingers tracing the worn embroidery of the Marine Corps insignia. Heroes walk among us. Sometimes in scrub, saving lives in the dark. If this story moved you, please hit subscribe and click the notification bell, because there are more stories like this, stories about the quiet heroes rebuilding their lives in places you'd never think to look. Leave a comment below. Have you ever underestimated someone only to discover you were completely wrong? Share your story. We're listening.